Welcome to Time for Health. I'm your host, Rachel Fall. We're very glad you're with us today. We always share some kind of topic, something that might help you or your loved ones learn something, and that's no different today. Today we're talking with some nurse practitioners. There'll be 3 on the show with us today. So as always, anything that we say here, don't necessarily use that as medical advice right away for yourself. You always want to include your healthcare provider in on your plans and your conversations first. So thank you for being here, ladies.
Good morning.
Lisa Ebert, nurse practitioner here in Port Clinton. Michelle Buer, nurse practitioner in Oak Harbor.
Good morning.
Good
morning.
You didn't know you were going to be a nurse practitioner and have to do like all these public speaking events.
No.
Well, we're glad you're here. I'm going to start with you, Michelle. Tell me a little bit about yourself, like where you're from, work history, like your path to becoming a nurse practitioner, because it's different for a lot of people.
Yeah. I'm Michelle Buer. I am from the Port Clinton area. I grew up here, raised my children here. I started off in nursing with my associate's degree, RN, through Lorain Community College. And then I went on and got my bachelor's degree through Bowling Green State University. And I've worked at Firelands Hospital for 23 years as a registered nurse. And then I decided to go back to school because I wanted to do a little bit more, and I went to University of Cincinnati on their online program and did 3 years through their program, and it was all online, and did my clinical rotations at a few different sites, specializing in gerontology. So I did the Veterans Home over there, and I did a family practice office in Sandusky, and I went with a nurse practitioner for a clinical rotation in Mercy in Vermilion. And now I'm with Magruder. I've been here for a year, and I'm working over in the Oak Harbor office with Dr. Blunt and Dr. Callahan, and I'm accepting new patients.
Okay. Awesome. So you started out with an associate's degree,
Yes.
RN, and worked in hospital.
Yes.
And you did a lot of different things
Yes.
in those 23 years.
Yeah, I did oncology nursing. I did long-term care nursing. I also worked with hospice care. And then I was recently, before I went back for my master's degree, I was doing case management, discharge planning, a lot of social work stuff.
And then you decided you wanted to go back to school.
Yep.
We're glad you did.
Yep. My children were grown, and I decided it was time. I was an empty nester, and I was like, why not? So my youngest was in school, so I went back to school, and I'm glad I did.
Yeah, very cool.
Thanks.
Lisa, what about you? What about your path?
I started out actually getting my bachelor's in nursing immediately out of high school. I was really thinking about taking a different path as far as nursing and going and getting my associate's degree or a diploma degree, but actually my dad talked me into getting my bachelor's, and I'm really glad that he did. So I went to Bowling Green State University, and then I worked for about 10 years and then thought about going back to school to become a nurse practitioner. Actually, a group of nurses I was working with in Fremont started looking at the program. It was very new. I've actually been a nurse practitioner for 20 years. So my path's a little bit different. I actually was in the middle of having my children when I went back to school and working part-time. And since I was going part-time, it did take me about 4 years to get my master's degree in nursing and then become a nurse practitioner. So I've been working now 20 years as a family nurse practitioner, mostly in Fremont, and just very recently moved to Port Clinton and now working at the family practice clinic here.
Awesome.
So
We're glad you're here too.
thank you. And I am also accepting new patients.
Okay, very cool. So nursing is now, to be an RN, do you need a college degree, or can you do it through a school that focuses primarily on nursing? Has that changed over the years?
It has, but you still have to go to a nursing school, nursing program, and they still have the associate degree programs, which are usually a 2-year program, and then you can get right in and start working as a registered nurse. A lot of the big hospitals, though, are pushing for them to go back and get their bachelor's degree right now. Okay. So.
And then for nurse practitioner, that is a master's level, to kind of equate it to the rest of the educational system. That's sort of a master's level. Yes. Can you also get a PhD?
You can now.
Yes,
and that's really been the focus in the last few years, is trying to have nurse practitioners move on to their PhD. So there has been a lot of thought that that may happen in the future
So
as
it's
well.
at least a master's level,
It's-
if not higher program.
Correct.
And like you discussed, there are lots of ways to go about it. You can do traditional route going, you can do online, you can go part-time, full-time, everything
Correct.
in
Yeah.
between.
Correct.
Okay.
Yeah.
So I know we kind of joke like, okay, what are the letters after the name? So can you talk a little bit about that, just so people can understand what that means?
When you do become a nurse practitioner or any advanced practice nurse, you do have to be certified by a board of nursing. And so there are two different boards available locally and nationally, I guess. So my board of nursing is the Advanced Nursing Association. That my initials are a little bit different than Michelle's for that reason, because your board of nursing was a little different.
Yeah, I'm a certified nurse practitioner,
Okay.
where there's two different type of exams that you can take.
Gotcha. Both get you to the same
Same.
spot. It's just two different boards, so sometimes the letters look a little
Yeah.
different
Yes.
after the names. I wondered that for a really long time because they can vary quite a lot.
Right.
And it depends on what you want. You can specialize in different areas too. If you want to be like a clinical nurse practitioner and work more clinically in the, like with the schools,
Okay.
or a family practice nurse practitioner, or I did gerontology nurse
Okay.
practitioner.
Gotcha.
And that's the nice thing about nursing. There are so many different fields and areas that you can work in. So there's such a nice opportunity in healthcare in general. So you can focus on one particular area, or it can be broader, like family practice. So it's stimulating, I think, to be able to make those kind of choices.
Would you have any advice for a young person who's maybe thinking about either nursing or becoming a nurse practitioner? Would you just say, just go for it, go all the way, or?
I think it would make sense to volunteer somewhere or even shadow someone in a healthcare field,
Yeah.
and take a variety of days to be able to do that, and maybe look at different opportunities, because there's not just nursing, but there's other opportunities in healthcare.
In
Yeah,
healthcare.
right.
Yeah, my daughter, that's what she did. She's getting her registered nurse here soon, but she volunteered first, and then she was working as an orderly at one of the hospitals. So she got to like experience, which I think is a good thing to see if you really can do it, enjoy it. You be with people and all the
Right.
aspects of nursing care.
You don't want to, I'm going to be a nurse, and then,
Yeah, like,
oh,
oh, no, I
do
can't
body
do-
fluids.
right,
Oh,
yeah.
whoops. Okay, so that's some good advice.
Yeah.
In terms of nurse practitioners, you are primary care providers. You are, I'm not, the equivalent of a doctor, but for instance, you're my nurse practitioner. So when I fill out my kids' school medical forms and it says your physician is, I just write Lisa Ebert, nurse practitioner afterwards. How do people address you?
I still have people call me Lisa, and I like that relationship. I think you really need to get to know your patients and be more on a personal level. So I think calling each other by our first names as you get to know them becomes very comfortable, and I think that helps to set the tone for your relationship.
Sure.
I agree too. I have them call me Michelle. Some people want to say doctor, and I'm like, no, I'm not your doctor. I'm not a doctor. I'm your nurse practitioner.
Right.
So,
And I think a lot of times now, there are a lot of nurse practitioners taking care of patients under the collaboration of a physician, but now the word provider is being used more often than physician.
yeah.
Do you, we've talked prior, do you work in Ohio? Do nurse practitioners work in collaboration with a physician?
They do.
Yes.
Okay. And
And-
how does that work?
You have a contract with the physician, or more than one possibly, where you can contact them. They don't have to be in the same building with you while you're working, but available per phone call if you had a question or needed to talk to them about a concern. And there is opportunities to touch base throughout the year and look at different patient situations, and so they're certainly a collaborator. Some states you do not need that collaboration. So there is about 23 states now that say nurse practitioners can work independently of a physician.
Very cool. Writing prescriptions, You
Yes.
can do that.
Yes.
You
Can write-
pretty much do a lot of things that like
prescriptions,
a
yeah.
primary care provider would do.
Make referrals to specialty physicians, neurology, dermatology, or
Order lab work,
Yeah.
and
Okay.
interpret labs, testing,
All
radiology
that good
testing.
stuff.
yeah.
Okay. And so working in conjunction with a physician, and so Ohio, you said Ohio is one of the states where you work in collaboration with a physician.
Correct.
About half the states,
You-
and you don't necessarily
Right.
need to. Okay.
Right. Yep.
What ages do you see of patients? I know, learning a little bit from doing physician recruitment that internal medicine is more in the adult world, so that was all kind of new to me. So what ages of patients do you see?
Well, since I specialized in gerontology, I see patients 16 and older.
Okay, so 16,
Yep.
not 60. Okay, 16.
Yep, 16. I prefer, yeah,
Yeah.
16.
I'm a family nurse practitioner, so I can see infants all the way up to the very elderly,
Okay.
so a wide range.
And is that a matter of like what school you went to or what board you were certified through or what?
What program?
program you went
Okay.
through.
And so you
So
can
since I did
do-
gerontology, I didn't do any pediatric rotation or OB rotation or any of that.
There are some nurse practitioners that do only adult care or only women care, and so there is a variety of opportunities as well, how you want to specialize.
So, and that's just something somebody would ask when they call the office or something?
Correct.
Do you see?
Yes.
Okay, awesome. Well, thank you. Any last minute thoughts before we take a quick break here?
Again, like I said, nursing, there's so many opportunities. Even if it's not as a nurse practitioner, nursing in general just provides you an opportunity to take care of patients in a variety of settings, and I don't think you'll ever have difficulty finding a job
Right.
Yeah.
because there's always such a need.
Yeah, that's good advice. Thank you so much.
Thank you.
All right, we're going to take a break and we'll be right back. And we're back. We're still talking about nurse practitioners, and we have a new nurse practitioner with us, Stephanie Gagne. Thank you for being here.
Thank you
You're a
for having
veteran.
us.
You've been on the show before a number of years ago, and Michelle still. Thank you for staying.
You're welcome.
So I'm going to ask you some of the same questions. Talk a little bit about you, where you practice, and kind of your path to becoming a nurse practitioner.
So I practice out in Marblehead
Okay.
with Dr. Jackson, and I've been with Magruder for almost 10 years. I went to Ohio State for my bachelor's right out of high school, and I worked at Ohio State in the medical ICU and at the James in oncology. And then I went right back into getting my nurse practitioner in the family route.
Okay. So you did family medicine also.
Correct.
So we were talking about all the letters after names. Can you talk a little bit about that, the two different boards and all that kind of?
So I was certified through American Academy of Nurse Practitioners. So I took a different board, I think, than Lisa, but I think you and I took the same boards. So in Ohio, we're known as APRN, Advanced Practice Registered Nurse. There's a couple of different kinds, whether they're a nurse anesthetist or not. So we, or midwife. So we're a certified nurse practitioner. So APRN, CNP.
That's your
Yes.
alphabet soup
That,
after your name.
part of it, yes.
Part of her. Yes, she's got more.
Part of mine, yes.
Now, you mentioned something that we kind of talked about in the first part too, about the different areas that you can be a nurse practitioner in. So you said midwife, nurse anesthetist. Are there others? And those are like very specific.
Specific subspecialties. So there's nurse practitioner for midwife, or you can just be a women's health nurse practitioner.
Okay.
Family medicine, adult and geriatrics, but even some of that you can even further special in, so they'll specialize in dermatology or orthopedics or oncology. There's further certifications that you can go to
Okay.
after you have your master's.
Okay. All right, good deal. And so you work in collaboration with Dr. Jackson
Correct,
and
yes.
Marblehead, you said. Writing prescriptions,
Writing
seeing
prescriptions, seeing-
prescribing,
correct.
lab work.
Lab work,
and
testing.
referrals, all
Correct,
that
yes.
good stuff. And so you are people's primary care provider.
Yes.
Okay, so when they fill out their kids' school medical forms.
Yes.
They write nurse practitioner on there too. Okay. So what is, I'll ask both of you this, and you can, whoever wants to go first, like what is a typical day for a nurse practitioner? You're both in a physician's office, so we'll go with a nurse practitioner in a physician's office.
Go ahead.
All right, so our office starts about, I start seeing patients about 9 in the morning, but I'm usually there doing whatever came in the night before, paperwork-wise. And usually we'll see patients from about 9 to noon in every 15 to 30-minute intervals, depending on what's going on with them. Lunch that I usually am working through, and then usually we'll see work till 5 most days of the week. And there's one day we have a late night clinic.
Okay.
Till 7.
I'm pretty much the same, but I start earlier. I start at 8 a.m. and I work later. Usually I'm there till 5:30. You know, Stephanie has some late nights too that she does. And I have a nurse that helps me with my patients. Initially, she'll put them in the room, talk them, do other assessment and everything, because I'm getting a lot of new patients, so it's a lot of papers that they need to fill out, get a medical background and all that I need to review and look over, and I kind of look at their medical history, and then I just talk with them and see what's going on for the day, and if there's anything they need, labs, referrals, anything like that, and then a lot of charting.
and there, you know, when you think about, I come in earlier to see all the stuff that came in, and I'm here afterwards to see that. And you know, I'm sure physicians obviously are the same way, but I think there's a lot of things that, you know, the non-medical person doesn't realize, that all those labs you order for us, you review them, or all those X-ray reports or physical therapy notes or things like that you have to follow up on, and
then look at what
this looks better, or this looks better.
And then you kind of look at what they would consider like the differential diagnosis. If there's something that could be multiple things going on, where does it kind of fit in, and what pathway do we need to go down?
Gotcha. Okay. You also have some additional certification. Talk a little bit about that.
So about 2-3 years ago, I stumbled upon something called the Creighton Model for Natural Family Practice. And it's a women's health type of area of medicine. And what that does is the Creighton Model helps people learn about their fertility in a natural way. And from 40 years of study on this, they developed something called natural procreative technology, or NAPRO technology. And that was a new women's health thing since about the early 90s, to try to figure out if somebody has irregular bleeding, polycystic ovarian syndrome, endometriosis, irregular periods, really crazy hormones, what's the underlying cause and how we can treat it naturally. So I kind of fell into that and went back to school for a 13-month certificate. And so now I'm bringing that aspect into my practice.
So for family planning purposes, fertility purposes,
all done naturally, yes, based on bioidentical hormones and things like that.
So can somebody still get a referral for that, but still keep their family doctor?
Yes.
So that's kind of
it's a subspecialty kind of thing.
So it's like being referred to an orthopedic person.
Correct. So
if I had somebody come in and is a young woman and she's trying to conceive and they're having difficulties, and I can make a referral over to Stephanie, and she can talk to them and they can help them with planning.
With that, and I wouldn't manage any of their other health conditions. That would all go back over to.
Okay, that makes sense. So it's a specialty. You get a referral or from, and do you need a referral, or can somebody just kind of
no, you can just
see this marvelous show and say, I think I'm going to call Stephanie?
You could just go ahead and call. Normally there's a charting aspect that we have to do, because we actually have to look at different biomarkers through actually cervical mucus that the woman would identify herself.
Okay.
So any NAPRO provider, whether it's a nurse practitioner or a physician, needs to have about 2 cycles of charting in order to figure out what's going on with her certain biomarkers. And we do have people in the area that do teach the charting, myself included, out separately, that we can get them established with.
That's pretty cool. What about healthy tips, or that you would, want an opportunity? I wish my patients knew, or now being this far along in my medical career, I wish people would, eat more vegetables or
Definitely eat more vegetables,
right.
or fruits and vegetables, and exercise.
Exercise is a big thing.
Activity.
And it doesn't have to, you don't have to go out and run the 5K.
No.
Just go walk around the block. Go
Yeah.
swim in the pool for laps, especially, or just walk in the
Go
pool.
up and down your stairs. Just do some little weights in your house.
Yes.
I remember reading a health article once, and there was a lady who was overweight, and she said, I couldn't hardly get up and down my stairs, so she started walking around the island in her kitchen.
Yes.
And that's how she started, and she was a great success story, and it just starts with something.
Well, and
Yeah.
even people who have a lot of joint issues or bone pain and stuff, even just walking in a pool, that's going to get them moving without having all that excess pain.
A little
as
bit of
well.
activity is better than none.
What are some of the more common diagnoses that you guys see? We do a community health assessment, and so things come up. A lot of times it's obesity related, diabetes, heart disease, that kind of stuff. Is that what you
We're
see
seeing
in your practice as
Yeah.
well?
For the chronic conditions.
Yeah.
And then what kind of complications kind of stem from that? If a person has diabetes, they're more likely to have heart disease or vice versa?
They're more likely to have heart
whatever?
disease. They're more likely to have either vision issues,
Gotcha.
skin issues.
And they
Could
say
lead to
that a
other things.
fair amount of health conditions are not caused by lifestyle, but could be improved by like the exercise and eating a fruit or vegetable every now
And
and
then
then.
you still have the genetic card you can't get rid of.
You can't do much about that. I remember a long time ago somebody said, be careful of the parents you choose, and I was like, what does that mean? Now I get it. I get it now. What other kinds of things do you often see, or tips would you give people?
Bring your medication list to every appointment.
Okay.
Whether it's prescribed, over the counter, vitamins, supplements, doesn't matter.
And why is that?
Because certain things that we may give you or somebody else may give you may not interact well together. So in an effort to kind of prevent like a polypharmacy effect and having adverse reactions to your medications, we can try and help
Gotcha.
fix some of that.
And I suppose that's maybe a little bit tougher nowadays because, you're my primary care provider, but I see you for fertility issues and I see somebody for orthopedic issues or whatever. And so there are multiple
Correct. So
Yeah.
doctors.
and a lot of the specialties will send us notes about what happened in their visit, but we don't go in and change the med list all the time. So,
Right.
if you're seeing a cardiologist and they change your blood pressure med or your statin medication or whatever, then you need to bring that information to us when you come see us.
It's kind of the patient who is the hub. I mean, and the primary care provider, but the patient is the hub that might know all this
Patient
information.
responsibility.
Yes.
We can do a lot. You're super smart, and electronic medical records are,
Can be helpful.
Bittersweet can be helpful, but that patient involvement and
Yes,
do you wish people would ask more questions, or do you think people have a pretty good sense of I'm comfortable asking questions with my primary care provider?
I think most of mine
Most
do.
of them.
Yeah,
There's
they
some
feel
that-
comfortable and can ask me questions, and if they have concerns or anything, I usually ask them to make sure they don't have any concerns before they leave
Right.
or any questions.
Usually I'm the one who I leave and I'm like, oh, I forgot to ask. Do you-
Call.
Call?
Yep,
Oh.
call.
Oh, well, hi there. I learned something today. Go ahead. Were you going to say something?
No, good.
And then I asked in the last session too, what about tips or advice for maybe somebody who's going into nursing or who wants to be a nurse practitioner? They talked about volunteering. Like, would you have any recommendations? Like, just go for it if you can, or
And shadow and figure out, because like they were saying before, there's so many different areas you can go into nursing. And you may think, I'm going to go into nursing and I'm going to do this. I'm going to be a pediatric nurse or I'm going to be an oncology nurse. And you get to that rotation and figure out that's totally not for
a
you.
good fit. So shadow,
Shadow.
try different experiences.
Yes.
And I would imagine that working through schools, they could set that kind of stuff up and all that. Okay. Are you guys open to having people shadow you?
I actually had one this past week. So
Okay,
yes.
there you go. That's
Yes.
very good to know. Any final thoughts before we wrap up that we didn't cover?
We're
No, I don't
good.
think so.
All right. Well,
Very
thank
thorough.
you both. And thank
Thank
you.
you.
Thank
Thanks.
you.
All right. We're going to take another break and we'll be right back. And we're back. I want to thank Lisa and Michelle and Stephanie for being our guests today, talking about nurse practitioners. It's not particularly new, but sometimes it's a little bit newer to us in terms of being our primary care providers and what they can do and how they practice and how they take care of patients and all their certifications. So learned a lot about all that schooling, both in terms of how they, as our providers, take care of us, or in terms of somebody perhaps wanting to pursue that line of nursing, nurse practitioners. A lot of great information today. Wonderful ladies, and they span the county. Let's see, Lisa works in Port Clinton, Michelle in Oak Harbor, and Stephanie out in Marblehead. There's lots of nurse practitioners in our community, so we thank them for all that they do. If you ever have questions about an episode, or if you have an idea, you can reach me at Magruder Hospital. Take this information, whether it's interesting to you or might be interesting to somebody else, share it with them. And as always, until we meet again, I encourage you to make time for health.